Welcome, all of y'all. This interview is with topper Dr. Sunidhi, who has got 22nd rank in FET exam, and she's been allotted Kraft Hospital at Kerala for FNB Reproductive Medicine. So many congratulations, Dr. Sunidhi, on this brilliant performance. Congratulations on getting the institute of your choice for FNB Reproductive Medicine. So first, let's hear from you a little more about yourself, where you did your UG and PG from, and then tell us about your strategy, how you prepared for the exam to get such a good rank. Dr. Sunidhi.
I am Dr. Sunidhi. I had done my MBBS and MD both from GMCH 32 Chandigarh. I was batch 2012 MBBS and 2018 for MD. I did SR shift of around 5 months from the same hospital, and 3 months, last 3 months I was in PGI. Basically for studying, I think you as a first year SR, you do not get time to read. But one thing which helped me was having my exams too close to this FET. So I was very thorough with the ACOG, RCOG, SRM and HTA guidelines. Secondly, ma'am, obviously I had joined your course. So I would, as you do not get much time, ma'am, so whatever time I had with myself, I would either watch the videos when I'm sitting idle, or I'll just go through the slides. So I actually did not have much time to prepare, but whatever I did was from, I am actually in debt about that, because I would just
so kind of you.
I would just go through all the slides and just be sitting in a corner. Agar rush nahi hota tha in the emergency, I would just go and on my iPad, I would just swipe through the pages and everything. As such, I never prepared separately. But as we all know, we have to pursue something after OBGYN. So you nowadays, we just don't have just OBGYN. So
yes,
I knew further pursue something. So I somehow, with talking to everybody and being scared of little obs per se, I opted for reproductive medicine. And obviously your name was there and everybody in my hospital would talk about you. So I blindly opted you.
That's nice. Thank you for those kind words. And you know what I get from what you're telling me is that you were a determined student. You cleared your PG exam and you would read in your duty hours. You did not take special leave. And so I remember this is what I used to do in internship, because I was so focused that I have to clear it in the first time. So that is what you did. You, whatever time you had, you utilized it, and you had the contents, you knew what to read, it was focused, and you cracked it in the first attempt. So congratulations for that. Also, to cracking it in such a short duration. Deciding and then cracking time was not much. You know, you decided, how many months did you prepare for it? When did you decide so exactly?
Ma'am, I guess my exams were done in May 2021. I started in around July 2021.
So you gave exams in 2021 and you cracked FET, just the next FET, which happened 6 months later. So that's wonderful. That's wonderful, cracking it in the first time. It's not even 1 year of preparation. It's just 6 months of preparation with all the, you know, I know GMCH emergencies can be, I have done as an SR, the duties there, it's tough. But the good thing about GMCH, as we were talking, is the academics is very good at that hospital.
Yes, ma'am, I agree, ma'am, totally. We actually, if not even while just practicing, even the consultants will
yes,
do
yes,
the same thing.
I have so much respect for all the consultants there. Brilliant people. All of them, I can name them and their special qualities. So I have a lot of respect for all the teachers at GMCH. And it's nice to, speak with someone who has, you've done your UG, PG, everything from GMCH.
Yes, ma'am. I am everything.
So of course that helps to be at a good center where the academics and practical work, everything is so good. And then you had the notes, you read well, whatever time you had, you read, and you cracked the exam.
So I don't know it is a good thing or a worse thing, because I never had written anything. I never used a copy and throughout, but I would just listen to it or read it all the time.
So that's also commendable. Most of the toppers are saying they sat, they wrote down whatever notes were there, and they would keep revising. So you're definitely an outstanding, brilliant student who were just looking at the videos, going through the slides, and you cracked the exam with such a nice rank. 22 rank is, something to appreciate when you get it just 6 months after your PG. So one more question about the big books. In this short time, during your PG and after that, did you have time to read Spiroff, Williams, Gardner's, all those books?
Ma'am, in PG time, yes, I did read Spiroff. Other books, no, I did not go through them. But yeah, Spiroff, I had read page to page.
Page to page you have read. And when you decided that you have to take the FET exam, did you start reading Spiroff again in that short period?
No, ma'am, I actually did not have time. Yeah, it was
That's
just
what
for the
all toppers are
preparation.
saying. Once you decide, you cannot continue reading Spiroff. It's a big book.
Yes, ma'am, probably. To start again, a big book is actually very difficult. I think
Difficult.
you cannot have a heart to start a big book so close to exam. So
Reading itself will take, completing one reading of it will take 6 months. So,
exactly, ma'am.
so one very important advice from all the interviews is that the day you decide that you have to crack the exam, that's the day you decide to close all the textbooks. You have to start doing focused reading. And it doesn't matter whether you have read those books or not. I've spoken with a lot of toppers. Spiroff is an interesting book. It's an important book. I am sure that while reading Spiroff, you must have decided that this is what I'm going to pursue. I'm going to do reproductive medicine because I love the book so much. That was the reason for me that I fell in love with reproductive medicine. So you had an interest in endocrinology and reproductive medicine part, and that's why you read the book. And I'm sure that even if you had not read the book and you did focus studying, you would have got such a rank without the book also. This I'm sharing because a lot of students now, the exam is 3 months later, they come to me saying that all the toppers are saying they have read Spiroff and we never read Spiroff. Do we stand a chance? So I think, yes, most of the students, if you do a focus studying, you do stand a chance despite having or not having read the big books. Is
yes,
that
ma'am?
Tell me, so did you practice the test series questions also? Where did you do the MCQs from?
Ma'am, actually, I did not do the MCQs. I did not have the time to go to MCQs.
You did not have the time. So that's brilliant. You had a lot of basic knowledge already. You did not have much time to complete everything, but you have got a wonderful rank in FET despite all that. So that's very nice of you. That's a good way of reading and managing to get such a wonderful rank. Tell me, FET exam is a negative marking exam. So what was your strategy? How did you decide how many questions to attempt and what to leave and what not to leave? How many did you attempt?
I think I just left 2 questions. I had attempted all of them. I do not know if it was the right approach or not.
That's the right approach. That is, you have to attempt maximum number of questions, because if you leave something that you could have marked correctly, you lose 4 marks right away. So you have to mark if you have read the question, if you have read that topic before, if you know about the topic. So this is what average the students have been telling me. 2 to 7 is the number of questions they left. So you left 2, someone left 7. So that's the strategy that the juniors have to follow. At least 95 questions is what I suggest you have to mark. Right. So any more important tips that you would want to give to the junior students?
Ma'am, I think consistency is 1.1 everybody should focus on. I don't think the most important thing is that you read every day. And it is somewhere in your head. It will always be there in your head. Even if you think that you're actually forgetting things, it is okay. It will be fine till the end. If you're learning every day, you're reading something every day, just not waste the entire day.
Yes. That's such an important advice. Consistency is important. It should be there in your head that you have to do something. You have to crack the exam. And that is what keeps you going. You have to read every day, however tired you might be. You did a 12-hour night duty, you did a 12-hour day duty, but you have to somewhere find time to give at least 1 or 2 hours to reading if you want to prepare for an entrance test. So that's a lot of discipline from you. That's a lot of determination that you've shown. And that's how you've been able to do it so fast in the 6 months period after your post-graduation. It's wonderful knowing all of you all, listening to all of you, the stories of all the students. Definitely we'll stay in touch, Dr. Sunidhi.
Thank you so much, ma'am.